Hey everybody, Dan here with Pain Free You. Today I want to talk about medications and TMS. And I don't really like getting into this topic because I'm not a doctor and I can't really give medical advice. So please take that with a grain of salt. These are my opinions, and hopefully I can give you a little bit of guidance as it relates to medications. And I get a lot of questions on this, so that's primarily why I'm doing this. Before I jump into it, it's a crappy rainy day. It's kind of cold. There's a mist coming down out of the sky. Super cloudy. If you see way off in the distance, and the trees way down there. Super foggy, actually, not cloudy. All right, so medications and TMS. People, the most recent question I had was, can I take medications and still get better with the TMS approach? The answer is yes. Many people have. Many people will take whatever the medications are that they're prescribed by their doctors while doing this work. And then when they no longer need the medications, they will, with their doctor's guidance, taper off of them and move on. And there are many, many, many people who do that and take that approach. Now, Dr. Sarno, for some of the purists out there, they say, Dr. Sarno said, stop all physical treatments. Well, isn't a pill a physical treatment? My understanding is towards the end of his career, he softened on that a little bit. And he started to say, look, if medications can help you get through the rough patches, or will bring it down so that you can focus on the TMS work, then by all means, do it. So I think he started prescribing some meds. I believe some of the other current TMS medical doctors are also on that same page, in that they believe that stuff will work. Regarding anti-anxiety meds, antidepressants, not a doctor, not a psychologist, don't understand exactly how they work, why they work. But I have had enough conversations with people that indicate that they just numb them out. They don't necessarily solve the anxiety. They just, I don't know. And you may find in this video, and if you know me, I'm not a huge medication guy. I don't necessarily think that our solution lies in a pill bottle. Not only for the reason that, that's kind of this will fix me, this little pill will fix me, which takes away all of our power from our ability to, with accurate knowledge and calming reassurance, to fix ourselves, right? I don't think we really need fixing. TMS doesn't mean you're broken. It means that, our brain and nervous system is perceiving danger. So I don't think a pill is going to necessarily resolve that. But if you find a medication that a doctor's prescribed to be beneficial for you, then continue to take it until you no longer need it. Simply put, that's my approach. As far as medication withdrawals, I have absolutely seen people get scared to death by the prospect of withdrawing from some of these medications, so much to the point that they're being told, yeah, you've only been on the medication for 7 weeks, but it's going to take you a year or 15 months to get off of it, because we got to go really slow, because if you don't go really slow, you could have X, Y, and Z problems, which scares the crap out of you. And if you're already a TMS person with an overly vigilant, hypersensitive brain and nervous system, what do you think that nocebo that going off the medications has to be done with surgical precision? Otherwise, you're going to really end up sick and maybe even die. I mean, some of these statements coming out of these medical doctors, psychiatrists, is absolutely full of nocebos, which basically is something bad's going on, right? And so I'm not a huge fan of pharmaceutical medication. I'm not a fan of fixing ourselves with a bottle of pills. If they're providing you benefit, by all means, keep taking them until you no longer need it, but do the TMS work. Don't view the pill as a cure-all. Look, an over-the-counter medication, if you got a flare-up and you're really hurting, I'm perfectly cool with you taking a couple Advil or ibuprofen or whatever it may be to get yourself through that rough patch. But that's, again, not a cure. The cure is teaching your brain that you're not in danger in the first place. So I absolutely see a lot of people struggling with medication side effects, medication withdrawals. And because they already came into that medication in a terrified state because of their symptoms, I think sometimes this hypersensitive nervous system is hyper aware of the chemical changes that these medications cause, and that can create a cascading effect of more symptoms. Is that a medication side effect, or is that a TMS response to the perceived danger from the medication and the brain sensing, no, I don't feel right because I'm on the medication? Or is it a combination of both? I don't really know. And my recommendations from Dan the layman, who's not a doctor, is if the medication is not providing you value, work with your doctor to get off of it. If they're trying to swap you into, 2 other medications instead, ask them, what's the harm if I don't take the medication, right? And if they're throwing medical labels out at you, or mental health diagnoses at you based purely on your explanation of the symptoms, and they don't understand how much TMS can create those symptoms to begin with, you're walking into potentially a lot of fear and a lot of confusion. And I don't think either fear or confusion is very beneficial for teaching our brain to settle down and calm down. So my overall stance is, if you don't need the medications, don't start. If you feel that you could really benefit by them, then take them. If you benefit by them, feel comfortable taking them until you no longer need to. But the work of getting better happens between the ears. It doesn't come in a pill bottle. So I know I'm sounding fairly negative as it relates to this, but I've seen a lot of people dealing with medications and having to get off of them and taper this, taper that, and the fear and the, and they just get so tangled up that now they don't have a TMS problem. They've got a medication withdrawal problem, and now they're being told they're mentally damaged because of the medications. You've been permanently damaged by the benzos, for example, and now that creates this whole set of beliefs and fears that's really challenging, not impossible, but challenging to walk back from. So if you don't have to take them to begin with, I know some people are going to say, Dan, you can't give that advice. From Dan, the layperson, I don't like them. Make your own judgment. And if you're on them and they're not providing you any benefit, talk to your doctor. Hey, doc, how do I get off of this? They're not helping. I don't like the idea of taking them. And if they tell you to take a different medicine, well, why is that one going to be any different than this one? And I don't know. It's a challenging topic. I'm very hesitant to record this and upload this because I don't want to be perceived as giving medical advice. I am not. This is just Dan's opinion. And as much as possible, I stay away from pills. I just don't think we need them. You can fix yourself right between your ears, right up here. And if you understand perceived danger and how that can turn on and keep symptoms persistent, then the solution's not in a bottle of pills. It's in teaching yourself through consistent messages of safety that you're not broken. So, I hope this video did not trigger anybody or upset anybody. Definitely not the intent. I just wanted to offer a little bit of clarity on my take on it. And what the heck do I know? I'm not a doctor, so I could be wrong about some of this stuff. I just don't like the amount of fear that I'm sensing coming through in the emails and the messages and the conversations on the phone. I don't like the amount of fear that I'm getting with people who are having side effects or withdrawal effects, and the confusion, and now in order to taper off of this one, I got to start a new one, and it just seems pretty insane to me. So, love you guys and gals. That's my take on medications. Not a huge fan. Only if you need them and only if they're benefiting you. Otherwise, see if you can get off of them. Give yourself a clean brain. No extra chemical influences on that your hypersensitive brain and nervous system might react to in a fearful way. I'm not saying they're bad for you. I'm just saying that to a hypersensitive person, our hypervigilant brain and nervous system might overreact to some medications that would be perfectly safe for a person that's not all jacked up on adrenaline and cortisol and fear. So anyway, love you guys and gals. Hopefully you found this beneficial. And I'm sure I'll hear it in the comments if it wasn't. So, love you.